Good afternoon, everybody, and welcome here to From Pills to Purpose podcast, where we engage in conversations that move us from medicated to motivated. So we've had a lot of fun. So Yvette, how are you doing today?
Doing very well. I'm really excited to discuss this topic because this gets a lot of traction and might get a little bit of a bad review, but
Yeah.
this is something that we have on our hearts and we get asked this question a lot. Example, Johann, you can tell us about this.
Yes, we finally decided to open that can of worms. So here it is. To give you a perfect example, anybody of our age, there's something that's constantly on their mind, and that is heart health. So this weekend I saw a buddy of mine, and one of his first questions was, what will you recommend I do with my cholesterol? So I asked him, what do you want to do with it? Because I want my cholesterol nice and high. So today we're going to talk about cholesterol, about what it's for, because I think there's a lot of people who don't even understand what cholesterol is doing in your body. Is it good? Is it bad? When you go to the doctor, obviously they tell you it's bad and here's a load of pills to get it down. But I think if your body makes it, it should have a pretty important role in our bodies.
You know, if you consider that your liver makes 80% of your cholesterol, I'm sure God had a plan with making our livers produce the cholesterol.
Yep, 100%. When we talk about the carbohydrates, that you don't have to eat them because your body will make every carbohydrate you need. So for that same reason, if your body makes it, it must be that your body needs it. And if you look back on the recommendations, back in 1963 was the first recommendation of a cholesterol level that they think would be beneficial for you. And instead of saying that it should not go lower than this, they said, oh no, when it goes higher than this, then you have to watch out. And that level was pretty high. It was between 150 and 280 milligram per deciliter. That's, if you come with that cholesterol level to your doctor right now, man, he might have a heart attack. You'll be fine.
Yeah.
Because he'll probably immediately say, where's the prescription pad? Let's get this fixed right away. But actually, I think your body really needs it. Yvette, what are some of the things that cholesterol specifically would be very important for?
Well, one of the big things is your brain. Our brain is 20% cholesterol. The brain does not have the ability to take it from the blood. So the brain needs to make its own, get it from the food and, produce it by itself. So it's really important to understand, and specifically in an age where so many people have got such cognitive decline, memory loss, they can't really focus. And cholesterol is one of the things that you need for your brain. But probably one of the things that is most important is the myelin sheath around your nerve endings. A ton of people don't realize that the little sheath that goes around the nerve endings is made of cholesterol. So when there's nerve damage, lots of time people trying to figure out what's the nerve damage. Well, you don't have enough cholesterol to keep restoring the myelin sheath. Then you have the synapses in the brain. So those synapses in the brain, that's part of your communication. So if that's not functioning well and the cholesterol is there, then we know where your cognitive decline is going. The neurotransmitters. So neurotransmitters, everybody always talks about the serotonin and the norepinephrine and all these receptors, but you need cholesterol there. I mean, you actually need cholesterol in all the cells, but your big major areas. And then the absolute most important thing, because if you don't have it, we will all around us know that is your hormones. And I think something that really struck a chord with me was when I looked at the chemical structure of cholesterol. And I looked at testosterone, I looked at estrogen, I looked at progesterone, even at cortisol, and they all are the basic cholesterol. And it was just like an eye-opener going, oh, hang on. We really need this, because if you don't have the cholesterol molecule, where's the testosterone going to come from? And I'm sure, just like you said, people of our age, our hormones are getting less. We still want to have them to function well, because without those, life is really not good.
Yeah.
And then a very important one, sorry, Johann, is the vitamin D, which in my eyes should never have been called vitamin D. It should be hormone D. Building block cholesterol. Definitely cannot go without that. We all saw what happened during the COVID era when people with such low vitamin D were the first to be susceptible to any kind of viral infection.
Yes, I just want to walk it back a bit. Remember what you said about the myelin sheath, about the nerves? Now, at some point, most of us probably have seen an electrical wire. Now, that plastic film around it, that is almost like the myelin sheath of your nerves. And another topic that came up this weekend was chronic pain and fatigue syndrome, where people are in so much pain, but they apparently don't know why. But think about it, if your nerve cells don't have enough myelin sheath around it anymore and starts touching everything else, what happens to an electric wire if it touches another exposed electrical wire? You get sparks. I can tell you that firsthand. It's pretty interesting. So the myelin sheath is very important. If you don't have enough cholesterol to replenish and feed that myelin sheath, you're going to have some exposed wires.
Exactly. And then the question always comes when you now look at these areas that we've spoken about, why would you want to have it lower? The body makes 1 gram of cholesterol daily because it's very essential. So if you want it lower, Mike, that's exactly why I would have had the same answer to the question for your friend. Why would you want to do that? And a big amount in our industry is spent on lowering the cholesterol. And you've had some data on some of the tests and the science studies that came out, and share some of that with us.
Yes. Actually, there's a little known secret of the FDA that they made a silent release of a statement. And it was that memory loss, forgetfulness, amnesia, and confusion were all directly related to statin drugs. So what are statins? Do they lower your cholesterol again? So I don't think it's directly the cause of the statin drug that causes the forgetfulness. I think it's a lowering of the cholesterol, because now your brain does not have the food it needs to function the right way anymore. Instead of lowering your cholesterol, get it higher. So,
but you know, that whole thing, and I've spoken about this a lot, about the fire with the fire engine. So when there's a fire and there's a fire engine and people are trying to kill the fire, so obviously every fire is caused by a fire engine. So the same thing with the cholesterol. Whenever there's any kind of incidents, when they look at the blood vessels or they look at the injury, there's a lot of cholesterol there. But what people miss to understand is the cholesterol is going there to heal. It's going there to serve a purpose. So just because the cholesterol was there, it didn't cause it. That's a very big distinction to make, because that would usually be one of the first things. Oh, but when they cut it open, there was a lot of cholesterol, which was trying to heal your body.
For sure, the cholesterol is a fire truck. It's not the fire, it's a fire truck that's coming to save you. So, and you can see it in just any type of injury too. If you have an injury in your body, broken bone or whatever, cholesterol will rush to that site in order to help with the repair. Because what does all our cells in our body have? Cell membranes. What is that cell membrane made of? Cholesterol. Hello. So if you damage that cell, in order to repair it so that it can function again, you need some cholesterol to repair it. And in a previous podcast, we talked about building blocks, Yvette, and people will say, oh, but what about this carbohydrate and glucose and such? When we will tell them, eat the building blocks and the superior fuel. And one of the things that is a building block for our bodies is actually cholesterol, because without that, you're going to have some non-intact cell membranes.
And you know, the fact that when we have these people who had the lowering of the cholesterol with a memory loss and the issues related, it had some serious repercussions on certain people's lives. People lost their jobs. They didn't know why. All of a sudden, you have this whole generation where there's a serious decline, and it could be prevented. And we
Yes,
are the next generation going that way. So that's why we want people to be aware of the absolute importance of cholesterol. Don't demonize something that is very necessary.
for sure. And for that reason, what you were saying, the people who lost their jobs and now they go to the doctor because, oh, doctor, I've got a problem. I can't remember stuff anymore. So, and it affects my work. Pretty quick, the doctor will diagnose you with something that is not actually even true. So they'll never tell you, oh, but have you ever tried to get your cholesterol a little higher? Stop doing the things that make it go lower. But they will always say, well, here's another pill. And not to bash the doctors, but it's just the way we were trained. You've got memory loss. Okay, let's give you something for your memory. You got brain fog. Okay, let's give you something to wake you up during the day. And I've got a lot of adults taking ADHD medicine, and then you kind of wonder that brain fog that they have, that where they can't hold on to a single idea for long enough.
Where does it
What are
come
they?
from?
What are they doing metabolically? And we've always talked a lot about metabolic health, that
Mhm.
and how it ties into brain health. And I think cholesterol has actually a big thing to do with it.
Well, when you see that, the neurotransmitters that we're talking about, if those are going to get fried and they're not working so well, so it's very quite explaining why so many older people are using the ADHD stimulant drugs for that, to keep that thought, to keep going, because I have seen a very, very big increase in that. And it just doesn't make any sense
Physiolo-
physiologically or even pharmacologically. It's like something there doesn't gel. But if you look at what is not working, it makes 100% sense. And from the studies that you were looking at there, what are the things that they found with the high, the lows?
Very interesting. There's two studies specifically that I want to mention. I'm not going to mention the names because I think the outcomes of the studies was more important. There was a study done of 12,000 adults over the age of 65. Now, that is not your average teenagers. So these are people who usually they will consider their health as something important. The lowest risk of all-cause mortality, which means all causes of death, the lowest risk was in the group with the highest cholesterol numbers. In the second study, there were 19,000 people, and the highest mortality was associated with the people with the lowest LDL numbers, what the doctor would call your bad cholesterol. The highest mortality, the highest rate of death was associated with those who have if they go to the doctor would be so proud of them having their cholesterol that low. They're at an increased risk of dying of all causes. And people might also sometimes say, when I mentioned this to somebody in the pharmacy, they said, yes, but all-cause mortality includes car accidents. Of course it does. Because if you can't think straight, if you can't concentrate on what's going on the road, you're going to make an accident.
Make a quick decision, turn, stop, you know.
Correct. It should be in there because if your brain is not working right, then you should not be driving.
So the low cholesterol was also associated with increased death in quite a numerous amount of things.
Yes, specific areas, and I'm not sure if it's mentioned in order of highest rate or not,
Mhm.
but death from cancer was associated with low cholesterol. Death from stroke was associated with lower cholesterol levels. Heart failure, and here we are trying to get our cholesterol low for our heart health, and then infectious diseases and liver diseases. So you said most of your cholesterol gets made in your liver. So a low cholesterol count is also related to liver disease or death from liver disease. So that kind of makes me think there must be some form of an association there. if your liver makes the cholesterol, and if your cholesterol is not high enough, that you're actually at risk of dying from liver disease.
So the question again, why would you want to lower your cholesterol?
100%. Not I, Your Honor.
Mm.
But I think, Yvette, a lot of people, we just mentioned it, the doctor wants the cholesterol low for your heart health. But is heart attack and cardiovascular disease, does it have anything to do with cholesterol?
So what really causes the cardiovascular damage? What causes the vascular damage? Where do all these blocked arteries, people getting triple bypass, where does this all come from?
That is the question, especially if we just determined that cholesterol is a fire truck to put out the fire. So I don't think demonizing cholesterol is really fair, because they're trying to tell the good guy that he's actually a bad guy.
You know, in all the years, this is something it just popped in my mind, and I've seen this very often, that the percentage of heart disease has tripled, quadrupled, I don't know the exact number, since cholesterol was declared the villain.
That is true.
Before that, there was a little bit, but it's an absolute astronomical amount of people that has that now. So that really makes you realize the importance of cholesterol, and are we fighting the wrong villain here? I often feel
Yeah,
like it's like a brick wall there, and I want to smack my head and say, people, this is not it. We're barking up the wrong tree.
I agree. And especially if you take that, 75% of people who have heart attacks
Uh-huh.
have actually normal levels of cholesterol. So there's only the 25% with abnormal cholesterol, which that is high or low, is besides the point. But 75%, like the
Uh-huh.
bulk of the people who get heart attacks, actually have normal or low cholesterol levels.
So that's a very good point in saying cholesterol doesn't really play such a big role with cardiovascular disease. I'm sure there's a whole bunch of other things that cause that.
Yes, maybe it's not the cholesterol. It just reminded me of it again because I listened to a podcast, and the guy that was interviewed is the writer of the book Atomic Habits. He talked about upstream habits. And what he meant by that is you look at where your life is now and then go look at that thing that seems to be unrelated to your condition that you do every day.
Uh-huh.
Go look up the upstream habits. And now, when we did our functional medicine training, we heard the story of the people drowning in the river. And the doctor came by and he said, "Oh, look, the people are drowning in the river." And he started helping people to save them out of the river. And then the pharmacist came by and said, "Oh, come help pull these people out of the river." And so all the medical professions came and said, "Come help us." And everybody is just pulling people out of the river. And the functional medicine practitioners looked at them and said, "No, we're going to walk upstream. We're going to see why those people fall in the river in the first place."
Find the
And that
source.
is exactly, if you want to look at heart disease, you have to go upstream before the cholesterol gets there.
Huh?
And most of the time, what did we find? That's microvascular damage is caused by inflammation, one of the big drivers of heart disease.
Chronic inflammation. And if that is something that your doctor is not looking at, your C-reactive protein, to see what is your actual inflammatory markers, that's very important. And there are so many things that impact that. And it's in a week where the new food pyramid has come out, and there's been a lot of controversy and people becoming aware of the fact that the animal proteins and the fats are so important for us, because there's been such a big substitution with plant oils and all these things that are manufactured. And the chronic inflammation is at an all-time high. Majority of people don't even know what it feels like to feel normal anymore. because their inflammation is so high. Now, anything with an itis, this can surprise some people because everybody would say, oh, I don't have swelling, my feet or hands don't hurt, but you might have some or other itis. You might have gingivitis. That's chronic inflammation. Even people with acne-related issues, things that come out on the skin, constant earache, infections and things, they don't realize, but these things are chronic inflammation. The body just has a different way to respond it for everybody, depending on how good or how bad your defense mechanisms are. So the true drivers of vascular damage is caused by, firstly, chronic inflammation. Then one that everybody is familiar with, insulin resistance. But there's such a lot of talk about insulin resistance, but there's very little being done about it. And again, if you are constantly feeding children at a young age high carbohydrate, processed foods that come out of a box, you are going to get insulin resistance at a very young age. And unfortunately, it's not a marker that it can be tested very early. You have to look at physical symptoms. Johann and I both know that him and I can pick up it easily because we ask the questions that go upstream. But your regular labs are not going to say, oh, you're insulin resistant. Because 99% of the time, there's really not a drug they can give for that. You have to change your diet. And as we've spoken about it before with insulin resistance, it's resetting the body so that it can do what it's supposed to do and not overloading it with all the processed foods, carbs, the things that our body's not supposed to be trying to process.
You mentioned something very important that we've heard the first time from you, where most labs that get done, they're geared towards producing a prescription at the end. And most of the labs that functional medicine practitioners do cannot produce that prescription. It's like an inflammatory market. It is a free insulin to see what stage of insulin resistance you are. Because most doctors will just test an A1C.
Fasting glucose.
Fasting glucose. And it does not really give you a good picture of where the insulin resistance really is at that point for that person. So, yes, we've talked a lot about labs, but those are two things that I feel is very important to get tested to see, because we're talking about heart disease and cholesterol now, and cholesterol is coming to put the fire out. But meantime, your inflammatory markers are high or your insulin is high.
And then we also have the environmental toxins. You can be exposed to certain things, whether it be in your workplace, whether it be in society. There are a lot of people where the environmental toxins play a massive role. They can be reduced. You can work on that. And then something that in our day and age, chronic stress. I know a lot of people live with the cause of their chronic stress, but a lot of people have their family being their chronic stress. So you have to identify what it is, and then you've got to work on it. And this comes back to what you and I do, Johann, with functional medicine. We do not only tell you, eat this, take this supplement, take this, and you'll be better. We look at body, mind, soul. What is going on around you? What is those stresses? What are causing them? That can also be a driver for vascular damage because it puts more stress on the body. And again, it goes back to cortisol, which cortisol also needs to be made by cholesterol. If you run high on these things, you can start seeing the pattern. If you don't have enough of the cholesterol, you really cannot sustain the stresses of a life. We also mentioned bad sleep hygiene. Now, sleep is so important. And I think you and I, when we do anybody's study, the most important thing for us when we come to the sleep is, are you actually sleeping?
Yep.
Or are you just putting your head down?
One of the first questions we ask is, how is your sleep?
Yeah.
And most people are so used to a bad quality of sleep that they don't even recognize that something's wrong.
Yes, that's true.
They're so used to being in bed with their eyes closed, but they're not really sleeping. Because I can tell you...
what's the quality of sleep?
Correct. They will tell you every noise that happened throughout the night, and you want to go, but I thought you were sleeping. Oh, I was sleeping, but I still heard it, and you were not sleeping.
Well, it's like the lady I was helping a couple of weeks ago and sleeps with the television on, with bright lights on. There are deeper lying issues that we have to work with, but that is not sleep hygiene. Sleep hygiene is a dark room where there's good air and good ventilation. You don't have any electronics. You don't have music playing. You don't have things like that. You've got to make sure you get that rest, because if you fully start understanding the body and the importance of giving the body time to heal, Johann and I are so strong and such strong supporters of giving the body what it needs, and it will heal, because God has given us such an incredible body. Your liver can heal, your kidneys can heal, but the bad damage is your heart cannot heal. Your heart is the one organ that the damage you've caused, you have to then start looking at ways and means to live with that. But you can absolutely prevent those from happening. So chronic inflammation, insulin resistance, looking at the environment a lot around you, chronic stress, bad sleep. And I'm really glad you touched on the topic of the numbers, because that has always been, to me, that's something that really disturbs me, is when I ask somebody, how are you doing, specifically in a health-related issue? And their answer is, I'm doing very well. My doctor says my numbers are.
Yes,
So, Johann, how are you really feeling? Are your numbers good? Or how are you
exactly.
feeling?
Exactly. That's a good question, because this is the question I usually ask people when they go on antidepressants, because they go to the doctor, get a new dose, and then ask them, how are you feeling? I think I'm probably feeling okay. No, how are you feeling? And that has a lot to say. One of the things that Hippocrates used to say was, listen to your patient. They will tell you exactly what's wrong with him. But the thing is, if we, with these low-grade inflammation, low-grade stress, those type of things, we get numbed. Our senses get numbed to how we're actually feeling. Now, if your numbers are great, but you still don't have energy, you still get up out of the bed and it takes you like 10 minutes before you can get upright. You're not feeling great. There's something else wrong, and it's not your age. Again, your age is not something that we can prescribe a pill for, but it does not have to be your age. It can be something else. So talk to somebody that is willing to go upstream and see, where is the beginning of the problem? Where is the inflammation? What is causing you to be tired all the time? Because just for your numbers to be fine, but you still feel like a train wreck, I don't think you're healthy. Something's wrong. Something's not working. And especially the numbers is not telling the whole story.
You touched on something that I always find very interesting, is about the age factor. You and I both know, and we always see this when a prescription is prescribed because a patient is a certain age. Now, I don't know about you, but I've looked at pharmacology, I've looked at physiology, I've looked at biology, and I haven't found that switch that turns on when you turn 50. It's not there when you're 49, but it turns on when you're 50.
Yes.
It flabbergasts me that today I'm fine, tomorrow I'm 50, now I got to go on a specific drug. And I do not understand the logic, and I don't understand that people don't question that. So
Sure.
how does it work? And there is absolutely any kind of scientific explanation for that. Don't tell me that. Don't give it to me, because it carries no weight. I'm always the one that advise people, what do you ask your doctor? Because there's so many people that will say, I really want to improve and I want to be better. So there's a couple of questions to ask. And one I'm really glad we elaborated on with the numbers is, what is my actual cardiovascular risk? Don't give me a number. Don't tell me, oh, your total cholesterol is 280 or whatever. Total cholesterol is a mathematical equation. It doesn't mean anything. I want to know, what is my real cardiovascular risk? That is a serious question to ask your doctor. If the doctor is honestly wanting you to go on any medication for cholesterol because they think that is going to reduce your cardiovascular risk, have a very open conversation to say, what are the side effects? And then The most important question I honestly push people to ask, because this is a make or break situation of your relationship with your current doctor and your new doctor. Can we discuss lifestyle changes? Is that something I can implement first? If you do see that there is a lot of resistance, or I remember one of the GPs that I used to work with and said, if a doctor immediately gets angry because you are asking him a question, then you need to go. You need to leave. He's not willing to help you. He's not willing to learn or listen. So those are important things to answer. Now, if you are lucky enough and you have somebody that can answer everything fully there for you, also request a full lipid panel. And once those results come back, obviously, if this is a good enough doctor, they knew what they're doing, they would have given you some lifestyle changes. So in the full lipid panel comes back, they will be able to have some discussion without, because Johann and I are about getting away from medication, from pills to purpose. So to find that change in your lifestyle, you could have stresses, you could have very high inflammation because of the food you eat, your environment. There are many things that we have discussed, but those are the questions that are very important for you to ask your doctor. Have an honest conversation. And if you cannot have that conversation, you need to go find somebody else that can really help.
Yes, I agree. That is such an important thing that you just said, Yvette. I mean, especially the lifestyle changes. There's so many things that you can do to improve where you are right now. And one thing that I want to mention, because we always talk, we'll ask people, apart from how do you sleep, we also ask them, what are you eating? Because inflammation, if you have low-grade inflammation, you're not hurting. You may be a little bloated, a little swollen, but you don't necessarily hurt and you don't know that there's inflammation. It might be something that you're eating that's causing it. So for that reason, find somebody, ask the right questions. And if that, when it comes to the lifestyle changes, it's not all one size fits all. It's not cookie cutter. Everybody is different. And you find somebody that is willing to sit down with you to go upstream and look at every single little detail of your life and pull it apart to see where the changes need to come. Because for some people, it's as easy as cutting out dairy, for instance. But for some, by our experience, there's a little more to that. You also have to do exercise and the right type of exercise. And you have to eat right. You have to cut out some carbohydrates. And fiber is not a human food. You don't need it. So
And
think about,
snacking.
snacking.
I mean, we've spoken about all these different eating modes. We can go on forever on that. It's just people be aware. And if you don't have anybody, contact us. We can do the same thing for you.
Yes.
We can go through it. We can look at it. We can give you the advice. We know where to look and what to look for.
Yeah, we usually put our calendar links in the show notes. So feel free. Hit us up, get on our calendar so we can see whether the problem you have is something that we can help you with.
And, you know, a point you made earlier on, and I always love to say to people, don't let the way you feel now, that's not normal. You've forgotten what normal is like. You've forgotten what it is to feel like and move around and do things and pick something up and play with your children or grandchildren or be active. I had somebody just tell me recently, I retired early. I'm 62. I retired early. I really wanted to enjoy my life and go places. And she said, in the last 6 months, I've spent nearly every week going to the doctor. And the question there was, this isn't normal for me. I don't want to be normal. So if you're that person that questions and says, this isn't normal, then we're speaking to you. The one that thinks it's status quo, it's just the way you are, you're getting older, your aches and pains, that's fine. But there are a lot of people. Listen, 62 is not old. I know people that are 82 and 92 that are active and doing things because they took care of themselves and they learned and asked the right questions.
100%. You know, while we're talking about cardiovascular risk and we talked about the numbers, read the lab order that the doctor writes. I don't walk out of the doctor's office without reading everything that he wrote on my lab order or my prescription. Not that I take any prescriptions. I haven't seen the doctor in 3 years. But I want to make sure that if I'm going to go get a lab test done, that I get tested for the right stuff. So and ask the doctor when he orders a lab, tell him you also want to know what your inflammatory markers is. You want to know what your insulin is and that type of stuff, so that you can get a full, complete picture of where your cardiovascular risk really is. And, depending on your doctor, it might be an eye-opener for him too.
And not only the numbers, but actually, how are you feeling?
Yes.
And is
For
there an
sure.
improvement? Continuously doing labs, continuously getting numbers, to me, is honestly not the answer. It gives you a bit of an indication where you're going, but looking at sleep factors, energy, strength, how your enjoyment of life, those are the important things. And there ain't any markers for that in a lab.
Yes.
You have to be honest with yourself.
For sure. And lab numbers is not productive at all if there's not a plan. And the plan, usually we talked about it a lot in the past. Lifestyle diseases can't be fixed by a pill. A pill might bring the numbers in line. You're not going to feel better, and it's not going to fix the problem. If you have a lifestyle disease, the only way it can get fixed is with lifestyle. So that is where you have to look at what you're doing, what you have been doing, and what did it bring you. And maybe it's time to change.
Well, I just had a quote that somebody told me today, and I think this is the absolute appropriate time to say it. Didn't think of it, but when you said that with a lifestyle change, and it really just struck a chord, and it said, a person's capacity for growth is directly linked to how much truth they can face about themselves without running away. So be truthful, be honest with yourself. Is this how you want to feel? Would you like to continue like this? Have you been running on the low cholesterol program? Would you like to fully function? Have everything work, fire on all the cylinders? That's what we propose. And cholesterol is one of those things that you need.
Yeah, it's actually a pretty important thing for your brain, for your heart, and for everything else. Definitely your hormones.
And for your family to survive around you.
Yes.
Your hormones.
Well, I think this was very informative. I think we gave people a lot to think about their cholesterol and what they want to do with that in the future. So I think we're going to sign off now.
I think it's important to realize cholesterol is important. Do not blame it. Rather look at other solutions for the problems. And I think it's a great eye-opener, because this is a question that we are both asked very often. So hopefully you learned from that. We can help. And it's just been awesome talking about this, because we've learned so much about it. And we really don't want you to be falling trap into those low cholesterol numbers with the increase in all the sickness and disease and death that you can get.
Yes, definitely. And we will post our calendar links in the show notes. Feel free to make an appointment with us. And please do rate our podcast, subscribe to any platform that you're listening to us, and leave us a comment. We'd love to hear your views. Take care, everyone.
Thank you so much, everyone.
Views and opinions expressed on this podcast are our own and are intended for educational and informational purpose only. This podcast does not provide medical advice, diagnosis, or treatment. The information shared should not be used as a substitute for professional medical advice from your personal health care provider. Always consult your physician, pharmacist, or qualified health professional before making any changes to medications, supplements, or health regimens. We are also promoters of Neolife nutritionals, beauty, and household products, and this stems from our knowledge of their purity and the company's reputation to provide products of outstanding quality. While we may discuss our experiences in the retail pharmacy setting and share insights into functional medicine, our conversations reflect our professional perspectives and personal opinions, and not those of our employers, affiliated organizations, or licensing boards. By listening to From Pills to Purpose podcast, you acknowledge that you are responsible for your own health decisions and agree that the host and guests are not liable for any outcomes resulting from the use of the information discussed in this podcast.